A study of Māori and Pacific health experts in New Zealand has found that many experience racist attitudes from government health advisory groups. Dr. Heather Kame is a senior lecturer at Auckland University of Technology and has recently published her study in the New Zealand Journal of Social Sciences. She spoke with Jenny Meyer about what the experts experienced.
So they talked about the tensions of being a one of one or one of two kind of people in the room in terms of trying to advocate for Māori and Pacific health. They talked about that kind of the ideological battle of getting Māori and Pacific evidence to be taken seriously alongside kind of Western notions of what well-being looked like. They talked about the problems of Crown officials that didn't have very well-developed cultural and political competencies in terms of holding the process and so not being able to make it safe for them as participants and or manage the behaviour of the other people on the committees.
What kind of impact do you think those sorts of attitudes have on how health is delivered?
Obviously there's those inequalities, but this is the upper echelons. These are people that are experts in these fields, and these are people that are really articulate and competent and capable. And if they're having trouble being heard, I don't know how that works or plays out for Māori and Pacific patients and families trying to access health services or more junior health practitioners. It's a worrying indication, and if they're not being heard, then their input isn't getting into the policy where we really need Māori and Pacific-centred policy if we're going to get health gain for Māori and Pacific people.
How do you think you can help this core group that have been part of your survey turn things around and get a different kind of attitude and improve things for everyone?
I don't think it's the responsibility of the Māori and Pacific leaders that we spoke to sort this out. I think that this is a problem by Pākehā Crown officials, so I think it needs to be the responsibility of Crown officials, the government officials, to lift the game. They need to develop the cultural and political competencies so that if they're inviting Māori and Pacific leaders in and taking them away from other work that they could be doing to help develop the policy, that they're looked after and they're listened to. It's bad manners to invite people into a process and then not listen to them.
What can be done?
Well, I think we've got to make sure that we're recruiting policy makers that have got political and cultural competencies and a base understanding of Māori and Pacific health. And we need to make sure that all of the experts that come in the room have some base understanding. If they haven't, why are they there?
You do sound quite critical, and obviously for good reason, but were all of your findings negative, or were there some things that you found that were positive? I guess whana ora is something that comes to mind.
None of the people that we spoke to had been involved in the development of the whana ora policy. So I think that what's going on is patchy. I think some folk are doing better jobs than others, but this is people's experiences over time. This wasn't a one-off experience. This is a pattern of behaviour. And it's when you look at the pattern of the behaviour that you see the racism. We're not saying, because it was a small qualitative study, we're not saying that this happens every time, but we're saying there's a pattern of behaviour that Māori and Pacific leaders in our study that participated in health advisory groups experienced and witnessed racism. It's not kind of that old racism where you call people names. It's that denial of Māori expertise and intelligence. It's kind of like a quite sophisticated racism where their ideas don't get written down, they're not taken seriously. And it's a lack of manaakitanga, a lack of care.
And I guess really if that knowledge was taken into account, everyone can benefit, surely.
Surely. Well, we know that if you lift the health of the most vulnerable, that improves the health of everybody.
Auckland University of Technology's Dr. Heather Kame.